Good afternoon and welcome. My name is Charlene Van Vleeman. I'm a program manager at the New Jersey chapter of the American Academy of Pediatrics. Thank you for joining us for the second session of this three-part Climate Change and Health Project ECHO series, made possible through a grant from the Energy Foundation. The Project ECHO model aims to build a bidirectional learning community where participants learn from content experts and each other. Discussion and interaction throughout the session are encouraged. This program has been designated for one AMA PRA Category 1 credit by Atlantic Health System, and it has been approved by the New Jersey State Nurses Association for nursing continuing professional development. Links to the CNE post-test and CME evaluation will be emailed at the conclusion of this session. Once your quiz is submitted, your credits will be issued and you can expect your certificate emailed to you within 30 days. Today's session will last 1 hour. The session is being recorded and will be made available to all registrants. The information to access the recording will be sent to you in an email. All attendees will be muted throughout the presentation in order to minimize any disruptions to the presenter. However, participating in the case discussion is encouraged. To do so, please use the raise hand function on your control panel and we will give you permission to unmute, or use the chat box. If you have questions related to the presentation, please submit them through the chat box as well. As a friendly reminder, please communicate in a courteous, respectful, and professional manner while utilizing the chat box. In order to support the growth of the ECHO movement, Project ECHO collects participation data for each tele-ECHO program. Before we get started, I'd like to take a moment to introduce our two hub leaders and our presenter for the day, who will be guiding discussion and offering expert advice throughout this ECHO. Dr. Shannon Eccles is a New Jersey native with a lifelong passion for science, nature, and health. She attended medical school at the Lake Erie College of Osteopathic Medicine in Bradenton, Florida, and completed her pediatric residency at Robert Wood Johnson University Hospital. She's currently a pediatric hospitalist at St. Barnabas Medical Center. Dr. Eccles is co-chair of the NJAAP Committee on Environmental Health and Climate Change, as well as a founding member of the Clinicians for Climate Action New Jersey. Our other hub leader, Dr. Jean Kraft, is board certified in pediatric critical care, general pediatrics, and medical quality. She graduated from Jefferson Medical College in Philadelphia and completed her residency in general pediatrics at the Medical Center of Delaware. She came to New Jersey following her critical care fellowship at the Children's Hospital of Philadelphia and is now at the St. Barnabas Medical Center in Livingston, where she is a pediatric intensivist. Dr. Kraft is currently president of the NJAAP, and she is a former co-chair of the Committee on Environmental Health and Climate Change, as well as a founding member of Clinicians for Climate Action New Jersey. Also joining us today to provide expert guidance is Dr. Uzma Hassan, an infectious disease specialist. Now it is my pleasure to briefly introduce today's speaker, Dr. Meg Fisher. Dr. Fisher is a world-renowned pediatric infectious disease subspecialist with many years of experience and practice and is a continuing medical education speaker. She is now working at the New Jersey Department of Health as a special advisor to the Commissioner of Health. She continues to work at Monmouth Medical Center in a new position, Medical Director of Clinical Academic Excellence. Without further delay, I'd like to turn it over to Dr. Fisher.
Thank you so much. Now going to try to share my screen here. Hopefully this will work. Okay. Okay. Are you seeing my screen? No.
We did for a moment, and then it went back to the grid view.
Let's see if we can get it back. We back?
We are back.
Excellent. Okay, thank you all. And thanks for the opportunity to be here as part of this ECHO. I think that we all understand that climate change is a major issue for us now, and certainly will be an issue for our children. And I think as physicians, we're going to be some of the people that see the results of climate change relatively quickly. Let me start with disclosures. I have no relevant financial disclosures, and I'm not planning to discuss any off-label uses of drugs. What I'm really going to do is talk about what's happening with vector-borne diseases due to climate change. So by the time we're done, what I would like you to be able to do is counsel a family about the increase of harmful vectors related to climate change, appreciate the value of a travel history, remove a tick, so you can remove a tick from your patients and teach people how to remove ticks, counsel about avoiding mosquitoes, and counsel about limiting fleas. So let's get started. So climate change is very important for vector-borne disease because it has both increased the number of insects and ticks and fleas, and it has broadened the geographic range of insects and ticks. So I think it's important to remember that we're going to see many more cases of disease because of these broader geographic ranges. The other thing we're seeing, which is not as much related to climate change, is the fact that we are invading the environment of all of the animals that live in our area. So within the city, maybe you're not going to see the same vectors, but within the suburbs and the rural areas, we're getting closer and closer. And in my kind of suburban area of Long Branch, I have to admit that when I drive to work in the morning, I now drive to Trenton, I often see deer right there in Elberon, and also among a variety of different areas. So the deer are getting closer to us. Many of us will find in the spring that the mice are getting closer to us. So we're really in a closer environment where we're interacting with animals who also may be carrying ticks to us. Climate change has resulted in longer, hotter summers, earlier spring, and mild winter, which is very hospitable for vectors and hosts. So we know that one of the most important things that we're going to think about is how do we avoid bites? And the major ways to avoid bites are to apply repellent, insect repellent, to clothes, and also in some cases to skin, and to cover skin. This is where it becomes a little bit of a problem, because covering up your skin in the summer is not exactly what we want to do, particularly when we're out of doors and we really want to be in shorts and running around. And that's when we have to remember we are clearly putting ourselves at more risk for vector-borne disease. So this is from the CDC website about insects and ticks. And it talks about the climate health connection, and you can read more of it right on the CDC website. And it's very readable and very nice, with lots of nice handouts that you may want for your patients and families. Now, it turns out that there's actually a division of vector-borne diseases within the CDC, and they really have formed a collaborative. So this is a national and international collaborative, really to look at research, prevention, and control of vector-borne diseases in humans. And it's not just the US, it really is a global project. Their vision is to have a nation here in the US where vector-borne diseases no longer threaten human health and well-being. And their mission is to protect people from illness, suffering, and death due to vector-borne diseases. And again, if you go to their website, you can get a lot more information about the things that are happening with regard to research, prevention, and control of vector-borne diseases. So this is right from their website, and here it is, www.cdc.gov/NCEZID, and the rest of it. And it really talks about this national public health framework for preventing and controlling vector-borne diseases. So their goals are to better understand how and when people are exposed and how they get sick and whether they die. They want to develop, evaluate, and improve the tools and the guidance for diagnosis and detection. And many of us are not as familiar with all of the now new tools for evaluation and diagnosis of vector-borne disease. They also want to develop, evaluate, and improve the tools and guidance for prevention and control of vector-borne disease. They want to develop and assess drugs and treatment strategies for vector-borne disease. And finally, disseminate and support the implementation of effective public health and vector control products, tools, and programs to prevent, detect, diagnose, and respond to vector-borne threats. So this is a collaborative. You can see over here, it's the involvement of the federal government, but also all of the local health departments. There are vector control agencies, and we have to be very careful as we use larvicides and other mosquiticides, other things within our communities. Healthcare providers are part of this because they're going to be diagnosing and treating patients. There are academic and industry partners to really work on the research aspects. Then we need policy and decision makers to ensure that when we figure out the best ways to do things, we actually can implement it. We need public health partners. And finally, we need the public and the patient to be involved so that we really decrease the incidence of disease related to mosquitoes, ticks, and fleas. And we're going to talk about all of those. So let's start with ticks. We know that there are hard ticks and soft ticks. The hard ticks are called Ixodii. This is the family of hard ticks. The soft ticks are the Agasidae. And ticks serve as vectors, reservoirs, and then they just bite people and suck your blood. So they really are aesthetically very, very unappealing because of the thought of this thing just sucking your blood. Furthermore, when they attach, they put a little bit of anesthetic in so that you don't, it's not painful. It's not like a mosquito bite where you can actually sometimes feel the mosquito biting you. The ticks, you don't feel them at all. And they attach, they get bigger and bigger and bigger as they fill up with your blood. Now, while they're attached to you, what they're doing as they're feeding is they're also kind of regurgitating and defecating. And the organisms that get transmitted are in that vomit, saliva, and poop from the ticks. And as they feed, they put some of those organisms into the host upon which they're feeding. Now, here are some examples of the ticks that are most likely to bite humans. And I like this because of the dime here. It gives you a feel for the size of these ticks. They're actually quite small. So these are the Ixodes ticks on the top, also called black-legged ticks. Then the Lone Star tick, famous for Texas, but you'll see its range is broader than Texas. And then the dog ticks. And there's more than one type of dog tick. This is a monograph put out by the CDC on tick-borne diseases of the United States. And it's really it's now in its 5th edition in 2018. And it's an excellent place to get information about all of these ticks. It starts with giving you clues to identify the ticks, and it shows you all the geographic distribution. And then it takes you through each of the diseases that we're going to mention today, but that we won't have time to talk about. So let's talk about the common ticks and what they transmit. So we'll start with the Ixodes tick. And the Ixodes ticks, Ixodes scapularis, is in the Northeast, the upper Midwest, and the Mid-Atlantic states. Now, if you go to California, there is an Ixodes tick there. It's the Ixodes pacificus. And it turns out it makes a difference where you are, because for Ixodes scapularis, the intermediate host is the mouse. And there are plenty of mice around in the Northeast, and the organism does very well in mice, at least the Lyme organism. Whereas in California, where there's Ixodes pacificus, that tick likes to feed on lizards. And in fact, it's not a very good environment. The lizards are not a good intermediate host for Borrelia burgdorferi, which is why we see much, much, much more Lyme in the Northeast than we see in California. But the Ixodes scapularis don't only transmit Lyme disease, they can also, and as you know, the causative organism for Lyme disease is Borrelia burgdorferi, but they can also transmit Anaplasma phagocytophilum, Ehrlichia murus, Babesia microta, and the Povasian virus. And what do these organisms cause? Well, you know that Borrelia burgdorferi is the cause of Lyme disease. Anaplasmosis is caused by anaplasma, no surprise. Ehrlichiosis by Ehrlichia, babesiosis by Babesia, and Pavasian virus disease by the Pavasian virus. So a variety of different organisms transmitted by the same tick, and occasionally it will transmit more than one organism at a time. So you can get co-infections. A person with Lyme disease may also have ehrlichiosis. As we also know, these diseases are self-limited diseases, and none of them really cause a chronic infection. We see certainly Lyme disease in children of all ages. Well, not really the newborns or the babies who are staying inside, but any child who goes out of doors and is in an environment where the ticks are, it's possible to get Lyme disease. Also here in New Jersey, we do see both anaplasmosis and ehrlichiosis, and we see some babesiosis. Pavasian virus has been relatively rare within New Jersey. It causes a type of encephalitis. And babesiosis is usually a totally asymptomatic infection in a normal host. In people who don't have a spleen, it can cause more severe disease, but mainly it's kind of an innocent bystander. Now, let's talk about the Lone Star tick. So the Lone Star tick's real name is Amblyopia americanum, and it is present across the eastern United States, but more in the southern part of the eastern US. And it transmits Ehrlichia, but different groups of Ehrlichia, so Chafiensis and Ewingi. It also can transmit Francisella tularensis. So the diseases caused here are ehrlichiosis, tularemia, and then southern tick-associated rash illness, or so-called STARI. STARI is very much like Lyme disease, but doesn't seem to have the later effects. So it really is the fever, rash, like early Lyme disease, and can be easily mistaken for that. The American dog tick, Dermacentor variabilis, is found east of the Rocky Mountains, and it can transmit both tularemia, so Francisella tularensis, and it transmits the rickettsia, so Rickettsia rickettsii. So the diseases are tularemia and Rocky Mountain spotted fever. So let's go on to a couple more ticks that are common in the US. The brown dog tick, and I'm not even going to try to, every time I try to pronounce this, I don't do a very good job of it, but it's Rhipicephalus sanguinis, sanguinis for blood. This is a worldwide tick. You can see it does look a little different than the other ticks, and it is a major cause of Rocky Mountain spotted fever. It transmits the rickettsia. There's then a groundhog tick called Ixodes cooki. It's present in the eastern United States, and it's important for the fact that it can transmit Pavasian virus. And it's been more recognized more lately as becoming more prominent. Now, in the Rocky Mountain states, we have the Rocky Mountain wood tick, which is a Dermacentor andersoni. It transmits rickettsia, Colorado tick fever virus, and Francisella tularensis. So you can get Rocky Mountain spotted fever, Colorado tick fever, and tularemia from these ticks. And then there are the soft ticks. So the soft ticks are the Ornithodorus, and these ticks are present really in the western US, but including Texas, which is more central. These are usually acquired at cabins or wood cabins out in the rural areas. And these ticks are much longer, they have much longer lives than the other ticks, and they are mainly indoor ticks as opposed to the other ticks, which are out and about. And what's transmitted by these soft ticks is tick-borne relapsing fever, and that's due to Borrelia hermsii or tourniquet. Now, this is where these different diseases have been reported lately. And you can see anaplasmosis is where the Ixodes scapularis tick is. So is babesiosis, so is Ehrlichia, and so is Lyme disease. But their geographic distribution is a little bit different. Lyme has a much greater geographic distribution and is a much more commonly tick-borne transmitted disease. But we also definitely here in Jersey see a fair amount of babesiosis, and we also see both anaplasmosis and ehrlichiosis. If we look at Rocky Mountain spotted fever, we also see Rocky Mountain spotted fever, but really Arkansas, Oklahoma, that area are even more common areas for Rocky Mountain spotted fever, but there are always a few cases in Pennsylvania and definitely more cases in Jersey. And then tularemia is not that commonly diagnosed, again, more common kind of in Arkansas in this area, but I definitely, since coming to New Jersey, have diagnosed 2 cases of tularemia, and in my 20 years in Pennsylvania, I saw a single case. So I think we definitely have some tick-borne, both of my cases were tick-borne. So we see tick-borne tularemia right here in New Jersey. So I showed you where the disease is occurring, but let's look at the range of these ticks. So if you go out and you collect ticks, you can find Ixodes scapularis all the way from Maine down to Texas and in Florida. So we don't see a lot of Lyme disease down here in the South, but those ticks can be found in all these areas. And as we see climate change, we're also seeing the ticks go up further into Canada. If we look at the American dog tick, it has a very broad distribution, both on the West Coast and then, you know, the entire central US and of the entire East Coast. If we look at the brown dog tick, it's really throughout the United States, and it really is a global tick. It's really everywhere in the world. Now, if we look at the Lone Star tick, it's more down here in Texas and in the South, but it is getting further north and getting all the way up to Maine now. And no doubt this does have something to do with climate change. So how do we prevent tick bites? We don't want to get any of those diseases. So in order to prevent tick bites, we really need insect repellents. And DEET is still one of the best insect repellents, and it is safe. So DEET, picaridin, IR3535, which I'm really not very familiar with, and oil of lemon eucalyptus are all good ways to prevent ticks. And when you're treating your clothing and your gear, you can go ahead and use a more potent ticicide, and that would be permethrin. Be sure to treat cats and dogs so that they're not bringing the ticks home to you. And then daily tick checks are important. The next thing to remember is to shower after you're outdoors and have someone do that tick check when they can actually see all your skin. The ticks like to kind of crawl up to get to an area where they won't be knocked off. So they tend to crawl up into the axilla, behind the ears, into the groin. So they're in areas where you are not exposing those areas to the out of doors, but the tick grabs onto you and then crawls up and gets to a safe place. The other important way to avoid ticks is to avoid the brush and stay on the trail. So in general, if you can see your sneakers or your shoes, you're not going to be in an area where there's a lot of ticks. But as soon as you get into the brush and you can no longer see your shoes, that's when you have to worry about the ticks. And the reason that is in order for ticks to find their prey, they don't really have very good eyesight. But what they have are chemodetectors that detect exhaled carbon dioxide. So the tick can best detect that when it crawls up onto the low-lying vegetation. So it crawls up on the top of the long grass strands or into the low bushes, and then it goes out on the end of a leaf, and it sticks out its little front legs, and the chemodetectors are on those front appendages, and they're measuring the exhaled carbon dioxide. So when you walk by or when a small animal walks by, the tick detects that in the air and then knows to fall off onto the tick. And that's the way the ticks work, so that if you stay on the baseball field, you are much less likely to get bitten by a tick. But if you go after that foul ball out into the woods, that's when you're going to get bitten. There's a wonderful study done in golfers, and they looked to see which golfers got Lyme disease. And as you can imagine, it was not the expert golfers, because they stayed on the fairways and on the greens, but the duffers, the people who didn't golf very well, who ended up chasing their ball into the brush, they were the ones who ended up getting Lyme disease. So let's talk about tick removal for a minute. And I like this picture from all of my pictures, by the way, are from the CDC website. I like this picture because here's somebody's thumb, and here's the embedded tick. So you can't see the head of the tick, and this tick is just beginning to feed because you can still see the body parts. Remember the picture of that tick that was full of blood? You kind of lose all of those body parts. And here's the way that you actually go to get the tick. But let's talk about things not to do. So if you use a hot match, you're very likely to burn the person, or if you're trying to take it off your pet, burn your pet. And if you actually make the mistake of getting a hot match onto a tick, all it does is upset the tick's stomach, and then the tick will vomit or defecate and then be more likely to transmit illness. So you don't want to use a match or any hot thing to try to burn the tick off. Alcohol, the only thing alcohol will do is give you a clean tick. It will not do anything to make the tick back out. As far as petroleum jelly goes, the theory here is you could smother the tick. That doesn't work very well either, because the tick only breathes about one time every 16 to 20 minutes. Fingernail polish will simply will cover the tick, but it will no longer allow the tick to move, so it's not going to work either. So what you want to do is grasp the tick, preferably with tweezers, or there are all kinds of little cute tick removals devices. And then you're going to grab that tick as close as you can to the skin surface and simply pull it out. If you leave some of the head parts in, don't worry about it, just leave them in. So let's switch from ticks to mosquitoes, because these are the other big vector bearers. And here's a picture of some of the local mosquitoes. This is an Aedes species. The Culex species is up here at the top. This is the Aedes aegypticus, and this is the Allopictus, and this is a different Culesta melanura, and these are the Anopheles mosquitoes. Now, what do these mosquitoes transmit? Well, the Culex species are found all over the US, and they transmit West Nile fever and West Nile virus. Aedes species were the major cause of transmitting Zika, and the Aedes aegyptica, which happen to live indoors and outdoors, were the best transmitters of Zika. So this caused major Zika disease in tropical areas, American Samoa, US Virgin Islands, Puerto Rico, but it also made it into the US. It made it into Florida and Texas. So there was local transmission in and around Miami and in Broward, Texas, very southern part of Texas. So with climate change, our concern is that the range of these mosquitoes is going to increase. And as you know, the major problem with Zika was with unborn babies who developed who had severe brain damage and microcephaly. As far as the Aedes aegypticus and Allopictus, they also transmit chikungunya virus, and chikungunya has also had local transmission in Florida. Main transmission is in tropical areas. So this is where it's very important that you ask travelers, where have they been? If they come back with an illness with a little bit of rash. In chikungunya, it's severe joint pain. Zika, it's a little conjunctivitis, a little flu-like illness. And then dengue is a major cause of hemorrhagic disease. It's transmitted in the tropics and subtropics. And again, it's by that Aedes aegypticus mosquito. There's no dengue in the US currently, and we're hoping that it doesn't come to our area. As far as Eastern equine encephalitis, there are probably a handful of cases every year in the United States, mainly in the Eastern and Gulf Coast states. And this is transmitted by this little bit different species of mosquitoes, the Colecetta mosquito. And then Anopheles, of course, is important for transmitting malaria. There are no Anopheles mosquitoes in the US at this time, but they are certainly in Central and South America, Africa, India, China, and many other places across the globe. So malaria is a global disease. Again, in the US, we're going to see it in travelers, but not in travelers outside the US, but not in local travelers. So how do you prevent mosquito bites? And this is just a picture of someone having a nice active reaction to a mosquito bite. So again, insect repellents are going to be the way to go. Treat your clothing and gear with the permethrin. Remove areas of standing water outside your house so that the mosquitoes don't have that standing water to reproduce. Put larvicides in large bodies of water that can't be, be drained. And then consult with companies about outdoor sprays to get rid of the adult mosquitoes. And of course, having screens on the windows and doors will decrease the chances that the mosquitoes will come into your house. So a nice little infographic from the CDC. Again, I've given you the websites so you can get more information on all these diseases. Well, what about fleas? So we don't think too much about fleas, but fleas also transmit diseases. So the cat flea is probably the most ubiquitous in the United States. It's found on cats, but also on dogs and on domestic animals. And it causes flea-borne typhus. Mainly you see flea-borne typhus in California, Texas, and Hawaii. I'm not sure why it's restricted to those states. And then the cat flea is essential in transmitting the organism that causes cat scratch, which is Bartonella henselae. It transmits it from one cat to another. So it's not that the cat fleas bite people and give you cat scratch, but the flea feeds on the blood of one cat and then feeds on the blood of another cat and transmits Bartonella henselae from cat to cat. Within the cat, the Bartonella stays within the bloodstream. So the question still is, well, if it's in the cat's bloodstream, why would you get cat scratch disease from being scratched by a cat? And the reason is that the cat scratches the fleas. It has flea parts under its claws. And as it scratches you, it inoculates the Bartonella organism. And then you can get cat scratch disease usually with adenopathy, sometimes suppurative adenopathy, adenitis, and sometimes systemic disease, including fever of unknown origin. The dog flea is not really very common, but it's involved in the transmission of Diphylidium caninum. So Diphylidium canine is a tapeworm of dogs, and what the flea does is the fleas are actually the intermediate host. So the dog, if it eats its fleas, can get the Diphylidium caninum tapeworm. And then what you'll see in the dog feces you'll see they look like little grains of rice. And those are the proglottids from the tapeworm. And a child can get Diphylidium if they inadvertently ingest the dog's fleas. So close contact with the dog can actually expose a child to Diphylidium. But again, not very common. But definitely reported, so not unknown. Now, the ground squirrel flea is much more important because it's involved in the transmission of Yersinia pestis, which is the cause of plague. So Yersinia pestis, this ground squirrel flea is really in the southwest of the United States, so out in Arizona, New Mexico area, where plague is seen. And the plague occurs there because of people either being exposed to the fleas or being exposed to the animals, or the cats can be a way that people get exposed to plague, because the cats are out and they bother the squirrels and the rats, and then they get plague from the fleas, and they can get pneumonic plague, and people tend to sleep with their cats on their chest. And then if the cat is sick, the cat can actually give humans pneumonic plague. And there have been several cases of pneumonic plague in Arizona, and also some buboes, so the usual way that plague goes. The Oriental rat flea is a global organism, and it's a flea of rats and is also involved in transmission of plague. So how do you control the fleas? And here it's important to really do some sanitation, clean bedding, rugs, areas along the edges of the walls where the fleas tend to hang out. And when you talk about flea control, it does kind of makes you want to itch. As far as treating your pets, bathing them and using a fine-tooth comb is a good way to get rid of the fleas. And then ask your vet about the best flea control. Often, if the pet is infested, you really need to treat the home. And here you need commercial pet control with follow-up treatment about 5 to 10 days later, because the fleas are very resistant to being controlled. So that's kind of what I have to say about these pathogens. I just ending with this picture because I loved it. Get the tips, stop the ticks. And this is a person putting on insect repellent. But if you notice, the child has a lot of skin open. So does the parent. So all of these areas are prime for being bitten by mosquitoes or ticks. This person who's actually working with, who's actually trying to find ticks so that they can find out what's in the environment, is dressed in the way we would recommend in order to prevent tick bites. But I think you can understand that it's a little hard to be dressed like this in the middle of summer when you want to be out playing on the playground. So I kind of leave you with that thought, and I thank you for your attention. I'm going to stop sharing. Okay. I'm happy to take some questions. Okay, let's see, maybe the questions are in the chat. Okay, so I think we don't have any specific questions, so I turn it back to Dr. Kraft, who I think is going to take us through a case.
Yeah, we do have a case presentation. Shannon Eckles is going to take us through a real case that happened in the middle of COVID when we were looking for COVID.
Yes, hi everybody. We did get 2 questions pop up. Would you like to address those first, Dr. Fisher, or would you like me to go through the case first?
I can address them quickly.
Okay.
Natural but effective repellents to recommend it. That's where the eucalyptus oil comes in. But honestly, DEET has proven to be safe. So I would go with DEET as your repellent. And those citronella candles, they don't do much of anything. Is the ECM rash for Lyme at the site of the bite? Yes, it starts at the site of the bite, but it then you can have multiple sites, because remember, you do get bacteremic with the organism. So yes, the original one is at the site of the bite, and it often it's not seen because it's on the back or in some area that you didn't even notice it. And I'm not going to give you advice on testing for Lyme, except to say, please don't test for Lyme disease unless you think there's a high incidence or a high likelihood that the person has Lyme disease. The serology is terrible. It will, in New Jersey, it will absolutely overpredict the positivity. And, much of the time you don't want to know. So the person who comes in and wants to be tested because they're fatigued, don't do it. Just say no. It's not important to test for Lyme disease except in people that you think have Lyme disease. And remember, if it's early Lyme disease with the erythema migrans, they will not be seropositive at that time. So that's a clinical diagnosis, not a serological diagnosis. And there are labs out there that test the ticks for sure. I don't really suggest that people get their ticks tested. The main thing to do is get the tick off of you. Remember, the tick has to be sucking your blood for about 48 to 72 hours in order to transmit disease. So if you just get that tick off, that's fantastic. It's the tick that you didn't see that's going to be the one that is more likely to transmit disease. For a while, the state was testing ticks and was actually asking people to bring their ticks in to be tested. And someone's in a school with a lot of ticks outside and 14 acres of fields and woods. Is it safe to have your playgrounds sprayed? It is. But remember, if you keep the playground with the grass low, the ticks, that's a disadvantage for the ticks. So, but you're seeing ticks on the students every day. So you should talk to someone about getting your area taken care of.